So I want to start with a little bit of the story of how I came into the space of designing specifically for autism. I've been now in this space for about 20 years, but it began with a request to design one of the first schools for autism in the Middle East. At that time, I looked for any kind of architectural guidance as an architect responsible for taking on this project. I looked for any kind of guidance and found none anywhere. Even the International Building Council that had a code for accessibility wrote back to me saying in 2002 that they did not have, nor do they know of, any guidance for designing for autism anywhere in the world. So we decided with the help of the school to create them ourselves. We worked very closely with the students, with the staff on campus for a year and a half, embedded ourselves within the school, working with parents to conduct surveys, interviews. We did structural observations of students in class, and ultimately we installed 3 test cases of a control group and a study group classroom in a speech and language therapy and a classroom environment, and looked at some of the architectural tactics that ultimately became the Autism Aspects Design Index. We then consequently published the results in 2008 in the International Journal of Architectural Research, which was the precedence for what became the Autism Aspects Design Index that we published in 2014. And Aspects is what we believe to be one of the world's first research-based set of guidance for thinking about the built environment through the lens of the autistic experience. Its first iteration is 7 principles that I'll walk through with some examples and illustrations. And in 2020, I was involved with an autism self-advocacy group, much like the story of the group that Elijah told, of students that came together in Ireland to create an organization that was informed by their needs. And I worked with them to create one of the world's first autism-friendly university campuses. And in the course of that, we expanded the Autism Aspects Design Index to include a second 2.0 layer of 8 additional factors to become 15 criteria. And right now, I need to add a bubble for our own group here. But at the moment, across 5 continents, Aspects is used to inform architectural design of buildings. It's being taught in architectural schools. Different researchers from all multidisciplinary fields, from public health to landscape to city design, are referencing Aspects in their work. So we're very happy to see it being used in so many different ways. And I was so thrilled when Caroline reached out to invite me to this wonderful group to think of how I can be in support of thinking of the built environment of your schools and service of your project. So just to go very quickly through the through the 15 principles, the first and most important one is acoustics. I think it's the one that comes up in almost every conversation we have. I think acoustics can be misunderstood in quietening spaces only, but I don't think that that's enough. I think we need to look at the intelligibility of human voice so that we can create quiet and comfortable spaces without masking the sound that's necessary to be able to socially engage and learn within those spaces. The next principle is a principle called spatial sequencing. And spatial sequencing, imagine it as the physical manifestation of the day in the life of a seamless activity within a space. So if I'm moving through a university campus, where I arrive, where I go to next, or if I'm arriving in a hospital environment, where I check in and then how I move to my appointment, that needs to be organized in a seamless way, in as minimally disruptive a way as possible, and we need to design that way. The third point is escape, and I think Elijah described it so much better than I ever could. We need to be able to create built environments that intentionally create respectful, safe pockets that individuals can retreat to, away from overstimulation. And those pockets can take a whole different range depending on the need of the individual. But the one guiding principle is they should not be isolating and stigmatizing. It's about creating an infrastructure of space that individuals can step away, but not necessarily exclude themselves from the everyday life of the space that they're in. And we've worked on using these escape spaces across healthcare, across education, in cities, and in all sorts of different contexts. And of all the aspects criteria, we found that they're one of the most effective. And reading your paper and your colleague's paper, Carolina, about how loneliness looks different across the allistic and autistic perspective, what immediately came to mind was allowing these sensory escape spaces for that regulation could possibly be helpful. The next point is compartmentalization, which here you see it on the urban scale, but on the classroom scale, it talks about organizing spaces in manageable partitions or manageable zones that only really include the sensory that we need for that activity. So not to allow any unnecessary sensory into spaces, but also not isolating individuals and activities. So it's about this careful curation of the sensory. The next point is transition, and transition is really important to locate at key points when you arrive, when you move from a high stimulation activity to a low stimulation activity. It's a respectful way to build in that moment to regulate and adjust before you're expected to enter an activity and be focused and productive. So transition spaces can be really helpful in educational environments, in hospital environments where there's a lot of anxiety before you go into certain treatments, and in certain waiting areas to allow that transition space to support. The next concept is sensory zoning, and sensory zoning asks us, similar to works with spatial sequencing, asks us to organize our spaces into low stimulation and high stimulation. So in the school environment, although we may want to put all our classrooms together in one space, if there are high stimulation activities happening in classrooms, maybe they need to be organized together away from the low stimulation activities so we're not disrupting the sensory. And of course, safety on different scales and different levels. And we could have a whole session talking about what safety means in the built environment. So part of the Autism Friendly University activity that I did in 2020 was the generation of the second ring of Aspects 2.0, an addition of 8 new factors. And I'll illustrate them here through a case study rather than going through each of them one at a time. And this is a case study of wayfinding. It happens to be in a healthcare space, which is not necessarily the only way that these concepts can work. And the reason I wanted to describe them through a case study is I really want to send the message that these concepts are not to be executed in isolation of one another, but they need to work in tandem with one another as a suite of activities or a suite of interventions. So here you see a hospital where we were creating a wayfinding navigation system that captures patients as they arrive from the parking lot with this visual stream or path, a tactile path that they can follow. This stream then carries through the entire hospital as a blue ribbon that was a pediatric hospital that children can follow and have that expectation. As they arrive in the main welcoming center, the artwork that you see hanging from the ceiling is not just artwork, it's acoustical artwork. It helps absorb sound because they wanted to have this big, open, transparent, friendly space, but we didn't want it to be overly echoey. We also have created what I call sensory perches of these little alcoved seating to the side where a patient can sit quietly off the flow of traffic and adjust and orient themselves to what's happening next. They have a straight sight line through to the waiting area and the clinical spaces so they can see what's happening next and anticipate what's happening next without necessarily engaging with it. And then the wayfinding and graphic communication was done with a lot of iconography and color. So it was a very visual wayfinding technique. In the Autism Friendly University, we also wanted to make sure that we brought together all of these concepts in social spaces. So this is an image of the student center, the Autism Friendly Student Center on campus. I fought to make sure that it wasn't tucked away and hidden deep in campus, but it is situated right on the central plaza of campus because we wanted A, to destigmatize autism, and B, we wanted to show off how beautiful an autism friendly space can be, not just beauty as aesthetic beauty, but beauty as in comfort, as in welcoming, as in inclusivity that Elijah talked about. There are pockets where someone could retreat to so they wouldn't have to hide under a staircase to have a moment of sensory regulation that everyone needs. And then we would also have a space where we could come together socially and safely. So other ways as we move through this hospital system, again, this idea of these sensory perches that you can look out and over different lines of sight, different ways that you can engage with the space. On the autism-friendly university, we also created autism-friendly dormitories and housing for our students, where even in this tiny little space, we're able to do compartmentalization, we were able to create escape. So sleep was something that was protected. We used lighting in a way that reinforced natural circadian rhythms that helped with sleep, helped manage anxiety and depression, using adjustable lighting, and using materials that were calming, and really conducive of comfort. And back to the hospital, how everything comes together. This notion of spatial sequencing as we move through the hospital, this notion of the care journey of a patient being mirrored in the plan of the space and allowing for different types and different arrangements of escape entirely along the way. And we've since gone back and done some experimental installation. So just this past year, I had an art installation at the Venice Biennale where we were able to survey users. We installed a simple escape space within a simulated environment of the overstimulation of our cities, and then surveyed both neurotypical and autistic experiences as they left the space for people to self-report their levels of agitation and calmness. And what we didn't expect, although we hypothesized, but we didn't even dream that it could be quite a correlation, that this is introducing an escape space in an overwhelming simulated city environment was just as helpful in managing agitation and stress for the neurotypical audience as it was for the autistic audience. It was almost to the number equally effective, which I think is an incredibly important thing for us to communicate to the larger population. And just very quickly, as I said at the beginning, Aspects is used not only as a design tool, but an audit and assessment tool, as a post-occupancy evaluation, retrofit, and design tool, and as well as something that we can frame our thinking around ground up designs. And I want to leave this conversation just with this quick diagram of reflecting back on the 20 years that I've been working in this space. Early on in the early 2000s, we really were looking at autism as an object or autism as a subject. But more and more as I engage with the autistic community, I'm finding that autism is an agent of change. And like Elijah shared, I believe autistic individuals and the ingenuity of how they manage their own built environments themselves. They are the first and best designers of space, and we need to give the space to hear their experiences and do a much better job designing. I always tell my students and clients, I do not believe that architecture can be neutral. It's either enabling or disabling, and we have a responsibility to hear and listen to the lived experience of autistic individuals and learn from their expertise, because there is expertise to learn around that built environment relationship. And finally, working with autistic individuals in research projects, recently bringing in autism as authorship. And I'll just close with saying there's been a lot of conversation around inclusion, accessibility, universal design, but I prescribe to a notion of universal delight. I think everyone has the right to be not only be in a space, but to feel not only safe in that space, but to feel joy and happiness and true social inclusion in that space. Thank you.